Hi guys, my name is Dr. Sisnett and I want to welcome you to my first episode in this series called Ask Dr. Sisnett. Now today, because it's the first episode, usually I would answer questions that would be posted on my Instagram, Facebook, and TikTok. However, since it's the first episode, I'm just going to give you some food for thought. Today we're going to be discussing behaviors and attitudes towards health, especially in the Afro-Caribbean community. This is something that I've noticed over my 10 years of experience that is very, very widespread. I have a lot of patients. I've seen a lot of patients in my 10 years. I've been in private practice, family medicine for the last maybe more than 6 to 7 years. And in this time, I've met lots of people with diabetes, lots of people with hypertension, and a lot of the times they are uncertain as to why they still have to take pills every single day. Many of them, maybe 95% of them, are obese or overweight. Maybe even more than that. Very few people I have met who are diabetic, hypertensive, and have either lost weight because of putting in the effort, or they're just genetically very small, and as a result of the fact that they are genetically predispositioned to developing hypertension and diabetes, they've just gone on to develop it due to poor habits. But for the most part, most people are overweight. And I feel like a lot of the times when I tell people they are overweight, the way they look at me is like they are shocked to hear this. And I'm looking at them like, yes, how could you possibly think that being 300 pounds is normal? Like just because you think that, because of the people that you've seen around you, your family members, they all eat the same food, they all have the same habits. They weigh 300 pounds because they eat and drink exactly what you eat, and that's why you weigh 300 pounds. And this is something that it seems to pass down from generation to generation. I've met families who have the son is fat or overweight, the daughter is overweight, the mother, father, everybody. Mind you, the mother and father don't share the same gene pool. So it's all about what they're eating and their lifestyle. And everybody in the household is obese. And this is not just a one-off. I've met many families like this. And the mother might have diabetes, the father would have diabetes and hypertension. And the kids, despite the fact that they're watching their parents struggle to manage their diabetes and hypertension, they still go on and continue to, function and have a lifestyle similar to their parents. And when you draw it to their attention, you're like, listen, you're heading down the wrong direction, you're heading down the wrong path. They'll say, okay. Which just shows that there's a lack of urgency when it comes to getting the right weight, getting to the right weight goal. Because people are more reactive than they are proactive, and it's a dangerous thing because once you develop diabetes, the only options stay on medications, and you can still potentially develop complications. But if you stay on medication and keep your sugar correct, you can live a very long life, or lose weight to reverse your diabetes. And losing weight when you have already developed diabetes can be even more frustrating because you're dealing with two issues. You're dealing with the fact that you still have to take your pills until your diabetes reverses. And then you're dealing with the fact that you have to put in the effort to lose weight, when you could just be trying to lose weight before you develop the diabetes and hypertension. So that's the main thing. I find in Afro-Caribbean communities, we're not proactive enough. We have to be proactive. We can do what is necessary to cut our weight down. If you weigh 300 pounds, this is not normal. If you weigh 250 and you're nowhere near 6 foot, you're in problems. You have to get that under control. If a lot of your fat is visceral, especially in the abdominal area, you have to get that under control. As a medical doctor, I don't like to tell people that they're overweight, but it's my duty to tell you that you're overweight, because my goal is not to put you on medication like people somehow think. Because that's another thing that I see under all my posts. Oh, doctors just want to put you on medication. Doctors just want to do this. No, we don't. We don't want to put you on medication. I don't want to put you on medication. I want you to be as healthy as possible. This I need you to understand. And it's so frustrating when I watch people deteriorate. and progress to exactly where I was telling them they were heading with their lifestyle. It happens so many times. It has happened so many times in my career. I cannot. It blows my mind. I'll give you a personal story. In my family, maternally, there is diabetes. My mom decided from very, very young that she was not going to develop diabetes. My mom is so meticulous with her diet, with her exercise. My mom is in her 70s, walking 8,000 steps, sometimes more than that. Now she went a little cold and she's gone back down to 4,000, but she's still active. And she made it a point to not develop diabetes because she lost family members due to complications from diabetes. People have gone on to die at a pretty early age because of diabetes. And that's where my mom was able to save herself because she's still up and about and she does not have diabetes and she's nowhere near an unhealthy BMI or body fat percentage. She exercises, she's active, and she's done very well for herself. Now, because of her healthy approach to life, she passed that down to my brother, my sister, myself, and everyone around her. And that has resulted in the outcome that my dad, my mom, my brother, my sister, myself, luckily for us, we have not gone on to develop diabetes. My dad did not have diabetes. And that was because she cooked in such a way, if a recipe called for 1 cup of sugar, she halved it. That's the kind of meticulousness my mom went to, that's how she went about her life. That's how she went about her life. She just was so meticulous with everything she did. She halved the sugar. When she did lemonade, very little sugar was added. And it still tasted good. That's how we have to go about our lives as Afro-Caribbean people. We have the worst health outcomes as Africans. It sounds bad, but if you read the textbooks, if you read the articles, we have the worst outcomes. And that's because of our diet, our lifestyle. We just need to get that under control and we can actually have very healthy outcomes in life. So my mom's proactive nature allowed this generation now to be very proactive when it comes to keeping their weight down and ensuring that they don't develop diabetes, hypertension. Now, by doing that, by just keeping your weight down, you have literally improved your life as you progress in terms of your age, because diabetes and hypertension increases morbidity, increases your risk of blindness, kidney issues, heart issues, stroke, amputations, peripheral vascular disease. You can have impotence. There's certain cancers are associated or are linked to metabolic syndrome, which is associated with diabetes. So it's just, there's a slippery slope once you start to develop these conditions. If you're pre-diabetic, it's not too late. But if you're diabetic, it's still not too late. You can still reverse your diabetes, but you have to get on it right now. Health behaviors I don't like. This, if you said this to any healthcare professional, trust me, they're just looking at you like, wow. I dislike when patients are unhealthy, living an unhealthy life, and you are counseling them on how to take their medication, telling them they have to take their medication like this, they have to take their medication every day. And then the first thing that they'll say to you is, they don't trust pills and they don't trust this. But the next question or the next conversation will be, is there anything I can take to get rid of this, or that would stop me from taking these pills? Now, here's my issue. Medications from pharmaceutical companies are actually more researched than the herbs that I'll tell you to take or that you could take to help with your sugar and your pressure. You distrust one company, which should be the pharmaceutical companies, but the herbal companies are unregulated. Many herbs that they sell to you as a cure, they can put anything in it pretty much and tell you take it and it's going to help with your diabetes. And lots of the time, maybe 90% of the times, you will not see any effects. But you'll trust them. But the proven, researched methods to help you drop weight, to keep your sugar down, taking the medications, you turn to the doctor and view us as the enemy when we're not. We have been telling you for years to lose weight so that you don't have to take the medication. And then when you go on to develop a condition as a result of your being obese or overweight, you then turn around and tell us, medical professionals, that you don't trust us. All we care about is giving you pills. That's confusing to me. I cannot tell you how many times, like, I've had conversations with people and I'm looking at them like, that makes no sense. Part of the whole being healthy lifestyle is having a good relationship with your healthcare workers. That's imperative. Like, you cannot go around this. Having a good relationship with your healthcare worker means that it's so good because if anything happens, you can have a discussion and say, well, you know, doc, I read this article or I read this about this condition, and you have a dialogue with your medical professional. If you start the conversation with, you know, we don't like doctors, or I don't like doctors, I don't trust doctors, that's totally, you've just put a spoke and a hurdle in the relationship between yourself and your doctor. And that alone, it might not affect the doctor's view of you, but it's going to affect how you process information, believe it or not. Because you're going to feel like when your doctor tells you to take one pill, you can take half. I've seen this. I've seen people take half dose, and the reason they take half dose is because they feel like the whole dose is so much worse than the half dose. When the whole dose is what's keeping the sugar in the normal range, the half dose is not having much of an effect. I've seen this. I've seen people say, oh, they don't want to take every day because they're going to get addicted to it. So they take half or they take one pill every other day. And I'm there looking at them like, the doctor told you to take it every day. The medication is, the duration of action of the medication is about 24 hours. So if you take it Monday, by Tuesday, say you take it Monday at midday, and by Tuesday midday, it's going to stop working. Which means if you don't take it again on by Tuesday midday, and you take it Wednesday by midday, between Tuesday midday and Wednesday midday, your sugar is going to be up depending on what you eat. Therefore, your plan does not make sense. Follow the instructions of your healthcare workers. They tell you to take the medication every day, take it every day. Don't take it upon yourself to come off a medication or half a dosage. That's a behavior that needs to change. Another thing too that I see, and it blows my mind, and I keep trying to figure out what's the goal. You're a person who is addicted to cigarettes. You smoke every day. You might smoke ganja every day. Whatever you do, you probably do it every single day. But the moment the doctor gives you pills, you say you don't want to get addicted. What are we doing? And this is a conversation I've had so many times. Again, it's just like, I'm just looking, I get so frustrated because, you mean like the cigarettes that you smoke? Cigarette companies are literally out there killing, they've killed more people than you can even count on. Like, it's ridiculous. Over the last 50 years, cigarette companies have killed a lot of people. What they put in the cigarettes, in the tobacco, is designed to keep you hooked. Nicotine is one of the most addictive substances on the planet. Yet, I prescribe metformin, and because of misinformation, that same person will be like, I don't want to take metformin, I'll develop cancer. And you're thinking to yourself, like, you've been smoking for 30 years. Like, you're not afraid of cancer. They literally put on the box, smoking causes cancer, or smoking can be bad for your health. And people pick it up and go, it's something I want to try. It says it on the box. But the medication that we prescribe, the worst side effect I've seen from metformin is diarrhea. Literally diarrhea, bad diarrhea. And there are people who can take some brands of metformin and get no diarrhea, and when they take another brand, they get diarrhea. So it's not even a situation where all metformin causes it. Sometimes it might just be the brand itself. And those same people who smoke, drink, will turn around and say to you that they don't want to take metformin because of the side effects. They don't want to get addicted to the medication. Let me just tell you one thing. I have never read that anywhere that people have gotten addicted to hypertensive and diabetic medications. Never. Ever. So I don't know why people come to those conclusions when it comes to taking pills. Here's another thing, another behavior that I think needs to change. People then say, I don't want to have to take this pill for the rest of my life. If I told you that there are people out there who wished that they could stay alive by just having to take one pill per day for the rest of their life, you'd be very surprised. If I tell you that one pill per day keeps your sugar down, complications away, and you choose not to take it for whatever reason, then I don't know what else to do to motivate you, because clearly you have lost interest in life. Your health is way more important than your ego saying to you don't want to take a pill every single day. That pill is keeping your sugar down, keeping your toes on, keeping your heart in check, keeping you from getting a stroke, from going blind, from developing all sorts of complications such as worsening periodontal disease. You name it, it can help you. Here's the thing. There's always options, If you want to come off of the pills, you have to go on a diet. And that's another thing too. In our community, people have issues with diets. They don't want to put in the effort required to lose all of the visceral fat, all the tummy fat that you can lose. They don't want to put in that effort. If you have to put in efforts of intermittent fasting, cutting out carbs, cutting out diets high in sugars, soda, you don't want to put in that effort. You have to exercise. Be mobile. It blows my mind sometimes that this can deter people from trying to be the healthiest version of themselves. So these behaviors are major issues in our community, and we have to change it. We have to. Well, and we can, but we have to make the effort. So let's continue to change for the better. And when the time comes, you may be able to come off of your medication and be healthier, but we have to try.
I just got a new coat still. Okay. Got a little brand new feel. Not so fast, switch blade, cut your car with.